Hello, everyone. It's Thursday, August the 4th. We're now up to 7,173 deaths in West Virginia. We've got 10 additional deaths. Again, I ask you to join me in prayer for all these great people that we've lost and especially all their loved ones. The 7,164th death is a 65-year-old female from Hardy County. The 7,165th death is an 86-year-old male from Marshall County. The 7,166th death is a 74-year-old male from Jackson County. The 7,167th death is a 51-year-old male from Mercer County. The 7,168th death is an 86-year-old male from Kanawha County. The 7,169th death is an 85-year-old female from Braxton County. The 7,170th death is a 93-year-old female from Marion County. The 7,171st death is a 75-year-old male from Harrison County. I'm sorry, I skipped one, I'm sorry. Let me back up. The 7,170th death is a 93-year-old female from Marion County. The 7,171st death is a 75-year-old male from Harrison County. The 7,172nd death is a 78-year-old male from Mercer County. The 7,173rd death in West Virginia is a 93-year-old female from Harrison County. Again, I ask you, if you know these people, please reach out some way. And if not, please offer up your prayers. Some way they'll know. They'll know. We can't let these great West Virginians just go in vain, and we absolutely need to let everyone know they're not alone. 3,036 active cases today in West Virginia, 968 new positive cases in the last 24 hours. Our daily percent positivity is at 8.45. Cumulative rate is at 8.34. Recovered cases are 550,054. We have 349, that's really up, and that are patients that are hospitalized. We have 53 in the ICU units and 14 on ventilators. We have a few random looking green counties. Mostly we're yellow with two counties, Monroe and Hardy, in the gold. We have one of our epidemiologists with us, Shannon McBee, and she's going to discuss this, but we think we have a presumptive positive case of swine flu on at least one of the human specimens that we have on August the 2nd on Tuesday. But Shannon, if you could come on and talk to us about that, please.
Thank you, Governor.
Hey, Shannon.
Yes, over the weekend we were notified by the Jackson County Health Department that we had some sick pigs in attendance at the Jackson County Fair, and that we had some individuals reporting with influenza-like illness. We have since then confirmed that we've got 2 individuals presumed positive for influenza A H3N2. Right now, the risk to the general public is low, but we do want to make sure that anyone who was in attendance at the fair, who visited the swine barn before the barn was closed on Thursday when the pigs became sick, if they are exhibiting flu-like symptoms, fever, cough, sore throat, that they visit their healthcare provider, especially if they're at high risk for influenza complications. These are going to be children, individuals who are elderly, or have compromising immune systems, or pregnant women, that they see their healthcare provider and are evaluated to see if they need antivirals. We are working with the Centers for Disease Control and Prevention to confirm the results of the presumptive positives, and working with the Department of Agriculture to confirm the presumptive positive of the swine positive on the pigs.
Well, Shannon, thank you a lot. I promise you that our good folks, and you see it all the time. You just see it right there with Shannon and all the different people that do the great work all across our state. If something comes up like this, we're on it. I mean, that's all there is to it, and they do fantastic work. So thanks, Shannon, to you, all your team, and all the great work that we're doing all across the state all the time. We ask for your caution, Jackson State Fair, or Jackson County Fair rather, and so anyway, just again, offer up your prayers. We're going to get through this. This is the risk is low, but we're on it. As far as our numbers, we continue to make our way slow but sure. As far as getting additional folks vaccinated and everything, and we're just going to keep at that. We feel absolutely strongly about it from the standpoint that every person we get across the finish line is a potential life we save. In regard to your booster shots, I remind you over and over and over, to me, there's just, it is really something that you have got, especially if you're 50 years of age and older. This is a very highly contagious variant that we're dealing with here, and absolutely without any question, you need to get your booster shot. Now, if you trust me, and I know a bunch of you do because we've run across the finish line, pulling the rope together. We've come a long, long, long ways. We want to win this battle without any question. There's a way to do that and a way to live with this right now as we speak. But we've absolutely got to keep pulling the rope together. And listen, I can't thank you enough, but please consider getting those booster shots. From the standpoint of our vaccine calculator, it can help you and notify you as to when, it's time for you to get those shots. Anything that is up on our vaccine info line, it's on our website. All you got to do is go there and you'll see that. We have 97 outbreaks in our long-term care facilities. That continues to go up just a little bit. Still in the church community, no outbreaks, that we know of, and that's really good. In corrections, we've got 86 inmate cases and 51 staff cases. I'm sure corrections is all over that, and they're monitoring and trying to do anything and everything we can do to help those folks as well. From our rental assistance program, it goes to our homeowners assistance program. For renters, for landlords, for homeowners, absolutely without any question, please, please, please contact us. If you feel like you've had any level of a deficiency almost anywhere, making your house payments, your utility payments, whatever it may be, you couldn't make rent, you got behind on rent, whatever, let us know. We'll walk you through the process. It won't take long at all. And we'll find out real quick if you truly qualify. We'll follow every single one of the rules and everything. I can promise that without any doubt in me. And absolutely, but if you can qualify, it'll really help you. So please call us. I remind everybody about giving blood. It's really important. The Red Cross always is in need, and so please consider that. This morning we had a shelter-in-place situation that was ordered in South Charleston due to some chlorine gas that was released from a decomposing 30-gallon drum of chlorinated dry bleach. The incident took place at the Clearon Corporation, which uses chlorine gas in the manufacturing process. The shelter-in-place was not in place very long and was lifted. And I want to thank all the folks at the West Virginia Division of Emergency Management, the Kanawha County Emergency Management Division, and all the other first responders that assisted in this. It was absolutely handled very, very quickly and very professionally, and all's good. So again, thanks to the great people of West Virginia that are working and trying to look after all of us all the time. We're going to have a sales tax holiday or holidays, and they'll begin on Friday, August the 5th, and will continue through Monday, August the 8th. And to learn more about this and everything and what can be purchased tax-free during this sales tax holidays period, all you got to do is visit the tax department website, and so I'm sure you can save some real dollars. And this is primarily driven towards, kids going back to school. And so there's lots and lots of items, whether it be clothing or school supplies or instructional materials or laptops or tablets or, sports equipment, whatever it may be. There's lots of stuff there that will help families and everything. And with our kids going back to school right now, and we want to take advantage of this. It's good stuff. Okay, last thing I've got is a couple of appointments, to judges. Yesterday, I appointed David L. Jackson of Glendale, West Virginia, to the Second Family Court Circuit, which serves Marshall, Wetzel, and Tyler counties. And Jackson is set to fill the seat that was vacated by the resignation of Judge Hicks, and we thank him, for great work and everything, and we look forward to Judge Jackson doing a great job. And yesterday, I also appointed Robert L. Ildearton of Logan, West Virginia, to the Ninth Family Court Circuit, serving Logan County. And I think it's Ildearton is set to fill the seat that was vacated by Judge Codis Poti or something, and I know I'm mispronouncing that, so please forgive me. But these two attorneys, I know will do an incredible job for the family court system there in Logan. So thank you so much and for stepping up and doing the job. Thank you again. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. Good morning. As the governor has said, there is just constantly more and more real-world information that basically demonstrates the incredible benefit of being vaccinated up to date on reducing deaths from COVID-19. We know that about 12,500 people in our country are dying every month of COVID-19. Yesterday in the US, we had over 1,000 deaths. That's 2.5 747 airliners that crashed, the equivalent number of people that died of COVID yesterday. And we know that the average, that 77% of people who have died in our country of COVID-19 have been over the age of 65. And we also know that only about 30 to 35% of those individuals over 65 have gotten the fourth vaccine, the second booster dose, and even fewer people over 50 years old, which includes about 95% of the people dying of COVID-19, have gotten their, who are eligible, have gotten their fourth dose or their second booster dose. So really, really important to have that as a protection, and also to test yourself, because if you feel that you're sick or you have, new symptoms, then if you test positive and you're in that higher risk group, then the medication Paxlovid is a very effective medication, reducing the risk of dying by about 90% in clinical trials. I'd like to recognize our state epidemiologist, Shannon McBee, who is joining us today, who's done really an extraordinary job for the state over the span of this pandemic and with many other things. But we know now today over 70% of COVID cases are from the BA.5 variant. And we, as the governor said, see that our hospitalization numbers are up a bit. Today's updated hospitalization numbers are 341 people in West Virginia hospitals with COVID-19. And we've seen that in other states where COVID has peaked earlier, the more urban parts of our country. But we still see the hospitalizations sticking and plateauing in those states, and the number of deaths going up in those states as well. So we want to be very vigilant and watching and making sure that we are advising our citizens to be able to protect themselves in the best way possible, which is really what the governor does every press brief. Last thing I'd like to mention is the White House is going to start an office that will be focused on long COVID. And it's estimated that somewhere between 7.7 million and 23 million Americans suffer now with long COVID. And as we've said, the more times you get reinfected with COVID, the more likely you are to get long COVID. The more severe the illness with COVID, the more likely you are to get long COVID. And we know that vaccination, full up-to-date vaccination, reduces the risk of long COVID in research studies between 10 and 50%. So again, even if you're younger, where perhaps you don't feel as concerned about dying from COVID-19, although we still see, again, COVID, the leading cause of death in our country in 2021 in 45 to 55-year-old Americans. But the risk of long COVID is substantial, and is another reason why staying up to date for your vaccines is so important. And please look and use the vaccine calculator to make sure that you're up to date with those vaccines if you have any questions. Thank you very much.
All right, thank you, Dr. Marsh. Next, we'll hear from Secretary Bill Crouch with the DHHR.
Good morning. Due to the statewide system outage that affected multiple state agencies last week, which has now been restored, DHHR has extended the deadline for accepting school clothing allowance applications for eligible children enrolled in West Virginia schools. Families may apply online at www.wvpath, that's wvpath.org, to submit applications. Applications through PATH must be received by 5 p.m. on August 12, 2022. A paper application may be requested by contacting the local DHHR office or calling 1-877-716-1212. That is 877-716-1212. Paper applications must be postmarked by August 12th. Each eligible child will receive $200 in benefits that may be used toward the purchase of school clothing, or piece goods for families who sew for their children. Thank you.
All right, thank you, Secretary Crouch. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. First of all, I kind of keep track of where we are with the number of people who've lost their lives to this thing. And just to keep it in perspective for myself, I don't know if it helps anybody else, but we've moved now past Dunbar. It's like every person in Dunbar was killed by COVID. So the number of COVID fatalities in West Virginia is now the 21st largest city in the state, which to me is mind-boggling. So anyway, for what that's worth. Governor, on somewhat of a lighter note, thankfully, there has been talk about the LIV Golf Tour and involvement in West Virginia. And obviously the Greenbrier would be a spot that would be considered. I know it's been in the works for quite some time, at least that's what I've been told. And I'm wondering how Greg Norman is and what the odds are of the LIV Golf Tour coming to the Greenbrier. And we saw some protests at the New Jersey venue for the tournament at its last outing from some 9/11 family survivors of people that lost their lives because the FBI has apparently found some connection between the Saudi government and those terrorists, that they were state supported in some ways. Is the baggage that comes with the LIV Golf Tour enough to make you pause a moment, or do you think the benefits would outweigh any possible negative connotations? Thank you.
Oh, Kenny, from a standpoint of, your question, I think really and truly bringing the LIV Golf Tour to West Virginia would be a really, really good thing. I think it would give the golf fans as well as an economic boost, to our state from the standpoint of if you just step back and just think about it, Saudi Arabia has been an ally forever, but the LIV Golf Tour is about a whole lot more than just Saudi Arabia. From the standpoint, you got to have somebody that provides capital to anything that goes on. But let's just stay on that just 1 second. For crying out loud, we fought a Gulf War. And really, and did that primarily because, as Kuwait was invaded by Saddam Hussein, the next step was Saudi Arabia. And that's when we had to step in right then to absolutely come running to the rescue of Saudi Arabia, our ally, because of the oil supplies. And at the end of the day, for us to harbor, whatever feelings it may be, and I surely understand, and I want to be respectful of everyone. At the end of the day, Saudi Arabia is our ally, and we should be proud of the fact that they are just that. But with that all being said and everything, I think the LIV Golf Tour, I know a lot about golf and everything, and my daughter Jill and her husband Adam have been really involved in maybe the possibility of bringing them here. Greg Norman is a class act guy, and you can just, anyone that knows him knows that and everything. But with that all said, the LIV Golf, what we have today in this country, and there's players and there's lots of people that are alleging, violations of antitrust laws, with the PGA Tour. And but the net of the whole thing is, we don't need any level, no matter what it may be, of monopolies that are trying to just say that we own golf or we own, football or whatever it may be. There's no one that owns golf. I mean, and that's just all there is to it, and that's the way it should be forever. Because there is so much room under the umbrellas, and so much potential prosperity and goodness under the umbrellas. LIV Golf is really dialed into kids, and I think that's really, really good. But you got a lot of superstar players that could come to West Virginia. We could have a real opportunity maybe to see them and everything, and enjoy the time. They've got a different approach to the game, where they're making it a whole lot more fun. Golf in itself, like it or not like it, has become semi-stagnant, and this is a way maybe to juice it up and maybe really just make it better, a better experience for fans and everybody. So, no, I think it'd be great. I really do, and I hope to goodness that it all comes together and all the powers to be are able to landed here in West Virginia. That'd be really good.
All right, thanks, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Dr. Marsh, could you talk a little bit about the hospitalization trends we can expect to see over the next few weeks? General Hoyer previously said he thought we were on track to hit the 500 patient benchmark by September 5th, Labor Day. Do you still think that's the case? Thank you.
Good, Governor, for me to go?
Please. Yes, sir. I'm sorry. Please.
Yeah. Thank you, Charles. And we are closely tracking the number of hospitalizations. And although we can do data projections, which we've done in previous parts of the pandemic, the truth is this becomes a more stuttering set of events. We know that there is a combination of people who are being admitted to the hospital directly for complications of COVID-19 and people who are testing positive for COVID-19 after they're admitted to the hospital for another set of issues. But because of the staffing concerns and because of capacity constraints that now exist in some hospital systems, we have moved our threshold to starting to activate more support and different types of interventions, working closely with the West Virginia Hospital Association and the hospital leadership to 500 people, as you suggested, Charles. We still have more capacity than that. And certainly as we watch this, we are both looking at hospital capacity, but we're also very keen to look at the age of people that are hospitalized and try to gain an insight onto how BA.5 and the severity of the people getting infected is starting to correlate, so that we can try to target a group of older West Virginians that we know are at higher risk for this infection and significant consequences, with both targeted information about staying up to date with vaccinations, which we've done, testing and being very aggressive about that if they have any new symptoms or they're around people that have been diagnosed with COVID, so that they can get quick access to Paxlovid, which is an oral medication that works very well at reducing the risk of both hospitalization and death in people at higher risk who are older than 50 and older than 65. Thank you.
All right, thank you, Charles. Next to Randy Yohe with West Virginia Public Broadcasting.
Good morning, everyone. Randy Yohe here with West Virginia Public Broadcasting. Governor, this is pointed toward the Hope Scholarship. The Intermediate Court of Appeals denied the Attorney General's stay this week, and now the Attorney General has asked the Supreme Court to file a stay and to handle the whole appeal. Meanwhile, there's 3,000 families that are counting on $4,300. School starts in a few weeks. It seems to boil down to using public taxpayer money for private education. Governor, could you detail a little more on your position here? Expand on just saying that it offers choices.
Well, Randy, I could, but I don't know that it's proper for me to get into additional details and everything. Without any question, we got 3,000 families, that are just hanging right now and unsure about what's going to happen, what to do this fall. That's not very much of a way to do business. That's for dadgum sure. We'll have to wait and see, what the Supreme Court does, but and hopefully we can expedite or we can't really expedite, but hopefully the court will expedite this, considering just how important this is to all those families. And Randy, I don't think me commenting directly on the integral parts of it is the proper thing to do, seeing as how this thing's in the court system, and we'll have to wait on the Supreme Court to give us a decision.
All right, thank you, Randy. Next, we'll hear from Jess Mancini with Ogden Newspapers.
All right, thank you very much, Governor, for taking my question. I guess my question is for Dr. Marsh. If I understand you correctly, we're not close to reaching the plateau for this latest surge. Is that correct?
Governor, you good for me to go?
Yes, please.
Okay. Thank you, Randy. We always track a bit behind the more urban parts of the country when it comes to realizing the full impact of the different variants that circulate most commonly in the US. And just like we have done with other variants, with this Omicron BA.5 variant, we are now seeing it be the dominant form of COVID-19 in West Virginia. And therefore, we do anticipate that we might see additional hospitalizations before we completely plateau. Walgreens does an index every week, which is a national index, and their index for PCR testing in our country went from about 38% to now about 37%. So it's gone down just a little bit. And West Virginia's, in their experience of their stores in West Virginia, is about 38% of people tested positive. So we're seeing still that slight rise, at least at some of those indices. And we do anticipate and we'll be ready to see the hospitalizations go up some. But remember, the hospitalizations are a measure of people being admitted to the hospitals and people leaving the hospitals. And our hospital admissions have been around that 50 to 55 mark pretty consistently. And it was again today. I think it was 52 today. So we're watching that closely. But the thing that we're really very worried about is not only the capacity of hospitals, but is really the impact to our most vulnerable citizens. And we were talking right before the press brief that the average age in the last month of people dying in West Virginia from COVID-19 is 79. And we know that the majority of Americans dying of COVID-19 are over 65. And we know that people that are up to date with their vaccinations, who get tested if they get sick, and who get Paxlovid or other interventions to further protect them and reduce the risk of hospitalizations or dying, very rarely die of COVID-19. So we have the strategies and the ability to protect all West Virginians from the worst outcomes from COVID-19, from hospitalization. from ICU admissions, from death. We just need to implement that at a higher rate because, as I said, if you look at people over 50 years old, then about 31% of Americans have taken their fourth shot, their second booster. And if you look at people over 65 years old, only about 35 to 38% of Americans have taken their fourth shot or their second booster, which is way too few given the great benefit that full up-to-date vaccination gives people, and particularly gives people in our most vulnerable age categories. Thank you.
All right, thank you, Jess. Governor, I'll turn it back to you.
Well, I've got one thing, and I was anticipating a question from Mark in the Eastern Panhandle. You know, Mark, you know, I don't know, you know, if we just lost you or whatever there, but nevertheless, I do want to report on Quarter H. You know, there's been some discussion that's going on right now of, you know, have we been in contact with Virginia, our DHHR, I'm sorry, our DOH, you know, have our Department of Highways been in contact with you know, the Virginia folks as far as finishing Quarter H? Now listen, let me tell you this. I am so proud of this, it's unbelievable. But we're having direct dialogue with Virginia as we speak. And we've been having that. And we've been having that, you know, as to where the right places are to join up together. Now, with that being said, it is major progress on Quarter H. We want to continue on. It is the very first project that we should be looking at to get completed in West Virginia. Will bring more and more and more folks to this great state. Lots and lots and lots of good stuff there. Second, I've said over and over, ought to be the Coalfield Expressway. We're working on that like crazy as well. But without any question, West Virginia, you know, informed Virginia of the revised schedule, and Virginia is reportedly looking at an alternative tie-in locations. I mean, that's all there is to it. So Mark, you know, I hope everything's okay and everything. I know you had to drop off, but I wanted to say that's great news, and great news for all the good work that our people in highways are doing, and we want to get this done. That's all there is to it. We want to complete it. But nevertheless, that's all I've got right now. Thank y'all so much.